Welcome to Facts TV News, where everything is true. Some education sector stakeholders want careful consideration given to calls to discontinue in-person classes amid COVID spike. Some stakeholders in the education sector are urging the government to consider carefully calls by medical personnel to discontinue face-to-face classes amid the sharp spike in COVID-19 cases. The Medical Association of Jamaica (MAJ) has made repeated calls for the government to scrap face-to-face classes until late next month when they feel the rate of infections would have subsided. But the United Nations Children's Fund, UNICEF Jamaica, maintains that schools are controlled environments where the virus can be quickly detected and those affected isolated to avert a spread. Reporters sought the view of the Jamaica Teachers Association and the Jamaica Association of Principals for Secondary Schools, JAPSS.
JTA President Winston Smith says the MAJ's call has merit and should be carefully considered.
Well, the call from the medical fraternity has merit, and it's becoming more clear and clearer that it is time for us to really give some thought, careful thought and consideration to it, because as we know, they are the medical people. They are the ones who have the skill set to make such determination.
He says there's increasing fear and anxiety among teachers as many are showing symptoms of the virus. However, Mr. Smith notes that many are not being adversely affected as over 76% of teachers are fully vaccinated against the virus.
The good thing is that some of them are not adversely affected because our teachers would have availed themselves to the vaccination, which means that though they are infected, they are not significantly affected. But of course, they would be contagious, and as such, they would have to stay home, which now will have a negative effect on the operation of school because the teachers are absent.
The JTA president wants the government to outline a clear direction of what happens going forward. He says some schools can continue operations for as long as they don't experience any teacher shortage.
In which case, if you don't have the teachers that will guarantee the safety and security of the students, in that case, that particular institution may have to go online while we still maintain the broad umbrella of face-to-face engagement. Because, Stephen, we don't want to say go and shut down right across the country when every institution is not facing the same challenge at the time. So we are exposed. We want to capitalize on any learning opportunity.
For his part, JAP's President Linvan Wright says he gets the impression that the government is already carefully considering the recommendations of the MAJ. He says most schools are coping well and have experienced no serious disruptions.
People are falling ill, but not regularly. It is not within the schools based on what I'm picking up as crisis proportions. No, it is not at a level where we would say that it is disruptive. We're managing whatever is happening in terms of cases. There are cases, we have had reports of cases, but the management of it is such that I don't think that it is disruptive. Because as you know, what we had prior, where people were coming in any at all, I think administrators really prefer to have something going than nothing at all, or just online where it's unreliable.
He says school administrators have developed appropriate programs to detect and isolate cases quickly. Mr. Wright says in incidents where COVID cases are detected among students, the Health and Wellness Ministry, the Education Ministry, and parents are alerted. But he's encouraging the government not to go against the advice of the medical stakeholders.
If it is at hospitalizations or at levels where if people get sick, we're going to have problems, I think it is something that we should consider. But we have to wait on the government. But I really would bet against what the health experts are saying. That's where I think it's wise to go.
Chang signals government considering laws to allow trained members of the public to assist the crime fight. Minister of National Security Dr. Horace Chang says the government will revisit laws that allow citizens to assist the police in curbing crime. This further applies to members of the public who are licensed to carry a firearm. However, Dr. Chang says civilians without a firearm can also aid in the fight against crime. His comments come amid questions raised about new approaches to address the country's current crime problem.
Not allowed, but should be revisited. Those were the words of Security Minister Dr. Chang when asked if provisions can be made for licensed firearm holders to help fight crime.
There is, under the old District Constable Act, which was, I think it's called the Rural Police Act, you could have members who have this requisite intention and training and integrity work with the security forces. The current law doesn't allow it, but we may have to examine it because citizen support is quality, and it does have to be those licensed firearm holders.
Dr. Chang says this should not deter civilians who do not have firearms from helping lawmen curb crime. He explained that everybody has an important role to play.
All citizens can contribute because in the crime prevention process, to be a mentor to a child in Whitfield Town or Greenwich Farm is part of the crime prevention. So this government is eager and willing to engage all our citizens. But there might be people who have had a retired JDF officer may feel that he would like to be a DC to work with the police in special operations. Once he shows the appropriate mentality, I will not entirely bother to go shoot people. You know? I'm telling you, if them shoot after the security, I expect them to shoot back. I don't expect them to take up a shot.
Meanwhile, Dr. Chang explained that persons will have to be trained, tested, and vetted before they are allowed to intervene. He explained that police are better trained to handle these situations.
But our policemen are trained well, not only in being able to use the special ops team, not only can use a firearm well, but they understand human rights responsibility. They have been given exposure to how to engage people positively as we seek to direct young men out of the community. Because if you're always trying to kill a young man, he's not going to come and listen to you. The purpose is to engage him and redirect him. But those who fight, I expect my police officers are better fighters. But you'll have citizens who can play that role. We'll have to evaluate everyone.
Early retirement decision overruled on appeal. The Public Service Commission has lost its bid to have the Court of Appeal overturn a High Court decision to reinstate a public servant who was sent on early retirement. The Appellate Court, in a ruling Friday, indicated that it would only allow, in part, an appeal brought by the Commission against the full Court's decision, which had cancelled the Commission's move to retire the former head of state-run Court Management Services (CMS), Deborah Patrick Gardner. Patrick Gardner, a civil servant for more than 2 decades, was granted 3 years leave starting in September 2013 to pursue a law degree to better carry out her functions. Having completed her studies in 2 years, she was attempting to resume her duties when she was informed of the decision. Patrick Gardner, who at the time was 43, was notified by the Commission in May 2016 that she was going to be retired effective June 1. Jacqueline Mendez, then acting Chief Personnel Officer, had advised Patrick Gardner in the letter that she was being retired on the grounds of reorganization in accordance with Section 61A of Pensions Act. Patrick Gardner, who was responsible for setting up the CMS, which oversees the administrative operations of the courts, was serving then as the Commission's principal executive officer. However, following an amendment to the Judicature Supreme Court Act in 2015, the CMS was replaced by the Court Administration Division. Patrick Gardner, however, challenged her forced retirement in the full court, which in April 2018, in an anonymous decision, declared she had been unlawfully retired. The court found then that the manner in which the claimant was purportedly retired was contrary to Section 125(3) of the Constitution, Regulation 26 of the Public Service. The judges also stated in their ruling that the purported reasons given in the letter were irrational. Accordingly, the court granted an order to squash the decision purporting to retirement the claimant, Patrick Gardner. But the Court of Appeal judges in their ruling disagreed. The manner in which the respondent was retired was not contrary to Regulation 26 of the Public Service Regulations. Regulation 26 is to be interpreted as applying to the retirement of a public officer in circumstances where there is dissatisfaction with a public officer or where a public officer is unsuitable or unfit to remain in the public service, the judges concluded. Patrick Gardner was represented by attorney at law Hugh Wildman. Bustamante sees six-fold spike in COVID-19 cases since January. There is a drastic increase in the number of confirmed COVID-19 positive patients at the Bustamante Hospital for Children, BHC, in St. Andrew, with a record of 29 admissions since numbers skyrocketed at the start of the year, putting a strain on the facility's personal protection resources, accommodations, and staff. Some clinics have also been hit hard by the influx of pediatric patients. Only 4 children infected with COVID-19 have died at BHC since 2020, and these youngsters all have underlying medical conditions. administrators at Jamaica's premier children healthcare facility reported. But with intake increasing weekly and with 20 minors who are also suffering from pneumonia, meningitis, urinary tract infection and trauma in admission with COVID-19 up to last Thursday, the hospital staff is sounding an alarm. More than 512 positive cases have been detected there since the first case of the disease was detected in Jamaica nearly 2 years ago. A six-fold increase in cases have been seen comparing to the total of 23 positive cases identified in the month of December 2021, with a total of 137 positive cases identified in the month of January up to January 17, 2021, reported Dr. Michelle Ann Richards-Dawson, Senior Medical Officer at the BHC. While increased numbers have been found in hospitalized children, their conditions have been mild, she explained, adding that most were outpatients. Only a few have been critically ill. However, these children have been found to have serious underlying medical or surgical conditions, which are known to be associated with increased risk of complications, she emphasized. Children in the 2 to 4 and 5 to 12 age groups were particularly vulnerable in December last year, followed by babies in the 12 to 23-month age-old bracket. But this year, children in the 5 to 12 age group have accounted for the majority of cases, with 6 months old and children in the 2 to 4 age bracket also accounting for high numbers. Some of the children turn up with coughs, runny nose, vomiting and diarrhea, while others are brought in for fever and frightened seizures. Screening for other medical and surgical conditions, such as kidney problems in admitted patients, have detected the presence of COVID-19. All children admitted last week were stable. Get vaccinated and vaccinate our adolescent population 12 to 18, wear a mask, practice hand hygiene and social distancing, and reduce or prevent exposures, reduce social gathering, Richards-Dawson advised, sounding a warning to parents and teenagers who are believed to be passing the virus on to their infants and relatives. She said the influx has resulted in increased usage of hospital resources, accommodation challenges, though additional wards have been created due to COVID-19 demand, and staff shortages, as some members have come down ill or have been placed in quarantine and isolation due to national health protocols. At a privately run medical center on Old Hope Road in St. Andrew, administrators last week said they have had to be hiring additional staff. We do testing here, and we have been seeing quite a few cases of COVID-19 positive children over the past few weeks. It has kept the staff quite busy. We have to bring in additional help to do with the testing and also to ensure that all protocols are observed, team member Yolanda Brown noted. They, the children, were symptomatic, and so their patients carried them in. It's either that their parents or their grandparents are positive, somebody in the family, and they were showing symptoms of it, she related, noting that children as young as 3 years old were turning up coughing with fever and vomiting. So far, there have been roughly 2 occasions in which children exhibiting severe COVID-19 symptoms have been transferred to BHC, but it all depends because we know the medical facilities are overwhelmed right now, Brown said. At 8 a.m. last Tuesday, 5-year-old Javon, whose name has been changed to withheld identity, could manage only 2 of the 7 Vienna sausages inside the small picnic bag his mother took for him at the Christian Penn Health Center in Portmore, St. Catherine. The small box of milk was equally difficult to swallow as his mother waited for testing under a designated COVID-19 suspected tent at the facility. By 9 o'clock, the area was filled with patients. On another day, young Javon would have referred through the lunch bag contents. Here, however, he was not himself and his mother was worried. 2 weeks after the civil servant fell sick after Mendlin later confirmed COVID-19 positive colleagues, she feared she might have passed it on to her son. She was infected with COVID-19 last year and dreaded the pain she felt for the boy. Last night, I realized my son burning up with fever, the mother exclaimed. The fever went as high as 38 degrees Celsius. I tried to see if I could get the temperature down with alcohol pills and so on, and I realized it was not going down. Then he was coughing and sneezing and telling me his head hurting him. This is not him. He would have eaten already, like a whole heap of things, before the morning, and he has not eaten. Even yesterday, he didn't eat anything, she bemoaned. I am hoping it is not because that would have meant that he would have to be doing contract tracing with his school as well. It could be from me, but he could also have caught it at school as well, she said of the boy, who has resumed face-to-face classes earlier this month. Several reports reaching reporters last week are that some schools were forced to close their doors after reopening due to an increased cases of COVID-19. I really think the Prime Minister Andrew Holness should reinstate the work-from-home mandate and let it be known among the directors that if the staff is not well, send them home, Javon's mother said. Javon's mother noted that her result had come back positive, but her son's result to Javon status was still not clear. Please remember to subscribe, like, share, and click the notification bell for daily updates.